student at Texas A&M College of Medicine. But why I advocate is because personally, when I was a child, my mom worked in a different city and couldn't really afford to take me to the doctor. So a lot of the times it was just a tough it out kind of thing. And even if she could have afforded it, there was no way she was going to be able to take time off of work or drive the 30 minutes it took to get to my school or to me. So that was definitely an issue, and I think that's also a reason why we should all be aware of what our patients are going through in their circumstances. Being impoverished in healthcare, sometimes you can't miss work to be seen for whatever problems you're having, and those problems affect your work, and it's just a never-ending cycle. And it could be in regards to your children that you maybe can't afford their medication or can't take them to the doctor, and as much as it hurts to see them go through it, it's not something that you can fix for yourself. So as physicians, I think it's important that we realize that these things are problems that are going to affect compliance, whether it is seeing a patient, getting them to come in, getting them to go in for a follow-up visit, taking their medications. Maybe they can't afford them sometimes. I know that was also an issue for my family in our circumstance. So simple things like that. It can also be just because they work so hard or work throughout the day, they're not able to take their medication at the times that you tell them to. So asking those questions and getting that background is very important for you to be sure that they're going to be compliant and that your plan is going to work best with what they can do. And that's why I advocate. So how I've advocated is before I came here, back home I shadowed different physicians and witnessed patients who had trouble finding transportation to get to the doctor or had to drive over an hour and a half to see a specialist. And so I would work with them to find alternative options and see how we could get them the care that they needed. And once I came here, I started translating at HealthPoint ABC here in Bryan, which is a low-income clinic. And by translating, I was able to help the Hispanic community get the proper care they needed and made sure that they were going to be compliant with the healthcare provider's plan. Currently, I try my best to take part in conversations that bring these issues into light and help my peers understand the struggles people in impoverished communities go through when it comes to healthcare. And this is how I advocate.